The OutSmarting Osteosarcoma has been in effect since 2017. Every year we review a bunch of proposals. This is the first group. We split it up this year, and I will pass it over to you because I don't want to steal your thunder.
So amazing. I mentioned earlier that we have 10 grants that we're funding this year, and normally we have like one part of the conference where we present them all, but we have so many this year, we actually had to split it up. So I guess that's not a bad thing, right? So I mentioned this morning that this is our 9th year, and cumulatively $2.5 million to 32 studies. And this year, we have $700,000 in grants, which is our largest funding cycle ever. Yeah. And I will say that is because of the tremendous collective power of our family funds and also some of our partner foundations. So you'll see we actually have 4 studies that we're awarding today that were funded kind of collectively by all our family funds. We have another 4 studies that you'll see that have been funded fully by one family fund, and because of Sydney, we'll present it in this session today. And then we also have a couple studies where we partner with other foundations. So Vision for the Cure, which will be represented in this group. And then later on today, Rise Foundation is another foundation that we're so happy to partner with. And so we have, again, it's really this truly collective pooling of all our resources to be able to support this amazing work. Let's go ahead and present these awards. Matteo, I'll let you do the honors.
Yes, it is my distinct honor to introduce all the award recipients one at a time. The first one is Dr. Amy LeBlanc at the National Cancer Institute, and her project is a comparative approach to exploring fluorescent in situ hybridization, known as FISH, as a biomarker for advancing the diagnosis, prognostication, and treatment of osteosarcoma. Dr. LeBlanc.
What a huge honor to be here. Just so moved by the support for our work. Maybe I could just say on behalf of all of the NIH colleagues that are here, thank you for being there with us. It's a hard time for us. We feel like we will persevere through everything that is happening, where we feel like our work and our dedication to cancer patients, whether they be 4-legged or 2-legged, our dedication will not end. We will not stop. And this project is really born out of inspiration from this group. The cool kids in this room inspired a lot of the work that we're doing to try to understand dogs and make real strides towards understanding that framework of the disease so we can really do the best job we can with canine studies and make sure that that information really translates to humans. So thank you.
Not only do you get a check, you get a cape. Congratulations.
Oh, thank you. Thank you.
Next up is Corey Weistuch, close enough, from Memorial Sloan Kettering Cancer Center, implementing personalized adaptive therapies in osteosarcoma.
So I'll keep this brief. Again, thanks to everyone, particularly the folks at MSK who helped make this possible. I guess just briefly, there have been a lot of talks this year, last year, and the previous years talking about all the advances in using single-cell technologies to understand osteosarcoma. My hope is now we've understood for the first time that different populations of cells in osteosarcoma have different drug sensitivities. So this project can give us an opportunity to actually start testing those and go on the pathway to start coming up with alternatives to map against these alternative cell populations that we know to consistently exist. So thanks to everyone, and I guess that's it.
You're ready for your cake.
Yeah.
Scoot over a little bit. All right.
Congratulations.
Excellent. Next up is Alexander Davies from Oregon Health and Science Universities, validation of MCL1 inhibition and combinatorial therapy for elimination of osteosarcoma lung metastases.
I'll keep this brief because I'm going to give a talk shortly, and I'll talk a little bit about this project. But I really want to thank MIB for bringing me into the osteosarcoma world and helping me fund this type of project. I was introduced to Christina, I think, about a year and a half ago, and it's been really beneficial for me to meet all of you and build connections and collaborations that have really driven us to this point. And also thank you to Ryan Roberts, who got me involved in the osteosarcoma realm. And this work came out of a true collaborative study that we did, and I'm looking forward to seeing what we can do with these findings and bringing them either to a decision point of whether they're worthwhile or getting them to clinical trials or not. So I appreciate all the support.
Thanks. So Dr. Davies' grant was actually funded in partnership with Vision for the Cure, and they're unable to be here in person to present the award in person, but they did send some remarks that they wanted to share.
Hi, we just want to say thank you so much for your partnership, Dr. Davies, and we are so excited to see and learn where this research goes. We did just finish up our 10th anniversary with Vision for the Cure, and it was a huge success. We look forward to working with you.
Congratulations.
And last but not least, Dr. David Ulmert, high-throughput characterization of pathobiological response in osteosarcoma tumors treated with LRRC15 targeted radiotherapy to uncover curative co-treatment approaches, and this is because of Sydney.
Right, and Dr. Ulmert's grant is funded by the Kaplan family because of Sydney, and we have Greg and Sarah, Sydney's mom and dad, here to say a few words.
Hi, everyone. I'm Sarah Kaplan, and this is my husband, Greg. We are the proud parents of OsteoAngel Sydney. Greg and I are grateful for the opportunity to fund this award today. It wouldn't be possible without the extraordinary generosity of our friends, the Patels. Today, we honor our amazing daughter, Sydney. She was and is the light of our life, and we miss her every day. Sydney fought this disease really hard. She persevered through so many challenges, and she was an inspiration to everyone, to us, and all of those around us. Sydney was also a very generous soul. Her favorite thing in the world was making and giving gifts to those that she loved. She also loved MIB, and particularly this conference. She really loved being in HQ and being surrounded by others that understood her and her experience. So today we continue Sydney's giving spirit by funding this award in her name. We are particularly excited to present this award to Dr. Ulmert. His proposal really struck a chord for us. His work has the potential to have possibly helped Sydney in her struggle, but also the chance to help many kids in the future, and we're really proud to be a part of it. Thank you so much.
Thank you so much, and thanks to the Kaplan family and MIB. The drug or the compound that we have developed in my lab together with many collaborators has taken 7 years. And finally, thanks to Lantheus, is going into the clinic this fall. And the money the grant that I get from the Kaplan family will help me to further understand how LRRC15 is regulated and how we can apply other treatment therapies together with radioimmunotheranostics targeting LRRC15 to make it even more efficient. My inspiration for going into osteosarcoma research is thanks to my friend who died many years ago due to osteosarcoma when we were in med school. So thank you so much for giving me the chance to develop these drugs. Thank you.
Okay, this is a great way to wrap up our first day. We're going to finish presenting our OutSmarting Awards, and we already talked a little bit about what OutSmarting is, so we're just going to jump right into presenting to our 6 young investigators this year. So, Matteo?
Okay, well, congratulations to all 6 of you. Our first Outsmarting Osteosarcoma Young Investigator Award goes to Ram Rao at Seattle Children's, Extracellular Matrix Degradation to Overcome Osteosarcoma Chemoresistance.
Thanks. So I'm a man of many words, but I'll keep it short. You know, this work is going to work towards creating 3D models, tissue engineered models of the primary disease site and the metastatic disease site, and then understand how matrix mechanics play into chemoresistance. But I will say the big thing about this is that this is not a me award, this is a we award. I have a fantastic team at Seattle Children's Research Institute, fantastic mentors in Dr. Beth Lawler, Dr. Mignon Lowe, fantastic clinical team, and Dr. Katie Albert, and everyone else on our solid tumor team. But this is also a thank you to all of you and all of the patients and all the families that have provided funds and support to make things like this happen. And so we are all gonna work together to understand this disease better, but also find better treatments. Thank you. Thank you. Where's the closest Chase Bank?
Okay, our next recipient is Afrin Periwala from UCSF, identifying mechanisms of chemoresistance in metastatic osteosarcoma using molecular barcoding.
It goes without saying, like, thank you to the MIB team, to the family funds, who has given me this incredible opportunity to do my bit as a researcher in advancing osteosarcoma research. I'll be, again, very brief. So my project is really going to look into the chemoresistance mechanism which happens in the metastatic osteosarcoma. I'll be developing models with MAP chemotherapy, and I'll have a very instrumental tool helping me, which is the molecular barcoding technology. So I will be like studying the tumor dynamics in response to chemotherapy and how it changes. And I hope that we find key vulnerabilities, which will pave way for the clinical trials in future. Thank you again.
Next, and this award is because of Ali Jihan from Memorial Sloan Kettering Cancer Center, targeting EphA2 with dual armored CAR T cells for immunotherapy in pediatric osteosarcoma.
Thank you. I would like to thank MIB agent and Wong Chang family for their generosity and support. Very briefly, my project is focusing on EphA2, which is a protein that's found on the cell surface and it's highly expressed in osteosarcoma tumors. And EphA2 is a very promising target for cell therapy due to its expression pattern and also its association with tumor metastasis. And we are developing an advanced CAR T cell therapy targeting EphA2. And also to make it stronger, we are incorporating 2 cytokine inducer armors that we have developed at Memorial Sloan Kettering. With the support of MIB agent and thanks to Isaac's contribution, we hope to develop a new immunotherapy that will provide benefit for future osteosarcoma patients in need. Thank you.
I am really honored to present the remarks from the Wong Chung family because of Isaac. And I also want to, before I start with the remarks that they asked me to share with you, I wanted to say this family has had such a positive impact on MIB agents, and though you may not know it, they've had an impact on all of you as well. This family has supported this year the recording of the sessions so that internationally and nationally, of course, we can share this research with people who couldn't be here today. Because the Wong Chung family is based in Hong Kong, this was really important to them. So, as is this award and your work. This award is because of Isaac and because of the unwavering support of those who believe in a future free from osteosarcoma. We are honored to fund this research in his name. Isaac's journey was one of extraordinary courage and resilience. He faced a diagnosis not as his limitation, but as a challenge to be met with strength and optimism. Isaac was diagnosed with osteosarcoma in October of 2021. The same week, he turned 12 years old. From the very beginning, he refused to let cancer define him. His world, once centered around sports, pivoted to new passions: gaming, design, and chess online. Yet through it all, he never lost his sense of humor, his brilliant smile, or his love of his family and friends. Even in his darkest days, Isaac chose joy. He embodied resilience, finding light when it seemed impossible, and inspiring everyone who walked alongside him. While osteosarcoma took him from us far too soon, his spirit, his determination, and his love for life continue to inspire us all. His family and his battle were not just about survival. It was about pushing boundaries, exploring new treatments globally, and fighting for every possible advancement, even when hope felt fragile. Isaac always lived with hope, persistence, constantly opening to shifting strategies of striving to stay ahead of the disease. He fought not just for himself, but for others, believing that progress must come, that breakthroughs were possible, and that one day, children who were diagnosed with osteosarcoma would have better options than he once had. Funding this clinical research is far more than just a scientific endeavor. It is a promise that Isaac's fight was not in vain, a promise that we will not accept that osteosarcoma has seen limited advancements over the last 40 years, a promise that Isaac's desire to raise awareness and find a cure will continue through every stride we take forward. Through OutSmarting Osteosarcoma's Young Investigator Award, we stand alongside the brilliant minds working toward that goal, believing wholeheartedly that breakthroughs are within reach. This funding is more than just a grant. It is love, it is perseverance, and it is hope embodied. It is Isaac's impact, still alive in every stride we take forward, because of Isaac. Because of him, this work continues. Because of Isaac, we move forward in pursuit of a cure. Thank you.
Okay, halfway through. This next award is because of Buddy. It goes to Janila Moresby at St. Jude Children's Research Hospital, synergy of ATM and PARP inhibitors in pediatric osteosarcoma.
Good afternoon, everyone. I feel truly honored to be here, and I'm so thankful for the Azima Golisarki family and Buddy for funding my research. I also want to take the time to thank my amazing mentor, Lily Gunter, sitting at the front right here. I couldn't be standing here without her support, and she's just so amazing to work with, so thank you, Lily. I also want to thank my amazing lab members who aren't here today, and everyone in the room for just being here and being so, in the need to fight for osteosarcoma. I personally lost my mom to cancer in 2018, so while she didn't have osteosarcoma, I do understand how most of the families must be feeling. And just to take some time to talk about my research, so we did a CRISPR knockout screen with PARP inhibitors, and essentially what we found was that osteosarcomas have a dependency on DNA damaging proteins or genes, if you will. And what we're seeing is that there's a synergy between ATM and PARP when you inhibit both that causes cancer cell death. And I'm just basically deciphering the mechanism and doing work in vivo and hoping to take this to clinical trials. So thank you all so much, and I'm hoping that we'll get some good results. And thank you again to the MIB agents for having me here.
Okay, and the Golisarki family couldn't be here today, so they were very much looking forward to attending Factor this year, but they're unable to join us as Buddy is scheduled for another amputation on July 3rd, and they need to be home to prepare. And Kat Azima, Buddy's mom, has kindly shared a few remarks for us to read on their behalf. In 2019, when our son Buddy was just 5 years old, he was diagnosed with metastatic osteosarcoma. And to call it a shock doesn't begin to capture the devastation we felt. We had no idea what lay ahead. 6 years later, after countless rounds of chemotherapy, more than a dozen surgeries, including thoracotomies, a leg salvage procedure, and eventually an amputation, we are still in the fight to save his life. This journey has shown us both the brutality of osteosarcoma and the strength of community. Determined to help families facing this diagnosis and to support the search for better treatments and a cure, we established a family fund with MIB agents. And through this partnership, we're proud to support initiatives like the OutSmarting Osteosarcoma Grant, which funds innovative research and offers hope where it's most needed. This fund is more than a donation. It's a testament to the power of collective action, and together we can make it better. And then I did want to note that their family extends heartfelt thanks to everyone for their incredible dedication and hard work in advancing this cause. And Dr. Moresby, they especially wanted to share how deeply inspiring your work is to them. It gives them hope for the future, and they are proud to support your efforts and look forward to the opportunity to meet you in person one day.
Next is an award because of Analia. Joseph Skeet, University of Minnesota, next generation dual CAR gamma delta T cells for the treatment of pediatric osteosarcoma.
Oh, sorry. You go first.
Oh, it's absolutely fine. I just wanted to thank MIB agents. This is one of the first conferences that I've been to where there is just an outstanding representation from the family and interest in the research that we do. And I truly think these Factor meetings are one of a kind. I'm inspired by the stories and the bringing together of, the research community, the osteo warriors, and importantly, the memories of the osteo angels. And I'm just, again, truly honored to be here and amazed that I'm up here being able to be supported by this group for this project that I'd put forward. Really quick about my work, we are utilizing non-viral genome engineering techniques to take an potentially allogeneic platform and do cross-patient treatments with dual CAR gamma delta T cells that are enhanced through base editing technology to make them resistant against the tumor microenvironment. and we do other indications for cancer. But yes, thanks once again, and again, it's an honor to be here.
And we have Pierre and Debbie Grillo, Annalie's parents, to share some remarks.
Hi. When our daughter Annalie died in August of 2020, we discovered a will on her phone, and she had requested that we donate the money that she had saved herself to make it better for other kids with osteosarcoma. And shortly after that, I discovered Anne, and immediately just knew that this is where we wanted to put our money and our efforts to fight this fight. And unfortunately, it was too late for Annalie, but it is not too late for every other kid that is suffering with this disease right now. And this is our third family fund because of Annalie. And the family fund is such an amazing opportunity. Number one, to keep the legacy of these children who are no longer here alive. Annalie would want nothing more than to know that she was making an impact and a difference for other people that suffered like she did. And as parents who have lost a child, which is a nightmare, as some of you know, healing is possible. And being of service to others is a pathway for that healing. And thank you so much, Anne, for creating this pathway, and to the brain trust in this room that is fighting this disease every day. Thank you so much. And we're really excited about the fund that we're doing. When Christina called me and I was going through my notes and she asked what fund we wanted to do, I had all these little stars next to Joseph's name, like great potential, really smart, really exciting. And I'm really happy that we get to fund your study. So thank you so much.
And our final award goes to Andrew Klugson because of Reese, oncogenic structural variation in the genome of pediatric osteosarcoma.
Hello. Just to say I am honored, very honored to be here at Factor, especially because of Paul, Christy, and Max Imhoff, and of course because of Reese. So my project details looking at the complex genomes of osteosarcoma because they're very unique among patients. So if initial treatments don't work, it's often very unique per patient. So my hope is that we can study these complex genomes to find the unique vulnerabilities for each patient's cancer and give patients a better chance. And as a bioinformaticist, I think I can speak for a lot of the non-pediatrician types who live in the dark but constantly dedicate their time to this crazy, terrible disease. I would just like to say that being here with the people at Factor, meeting people like the Imhoffs, and of course people like Reese is just incredibly important. It's essential that people like me who don't meet the patients on a daily basis, like some of the people in my lab do, we need to have the perspective that brings about the urgency of what we're working on. And I'm hoping that Factor can continue to help with that for people like myself and everyone who comes later. Thank you.
Hopefully you guys can see me behind the big stand. I'd just like to introduce myself. My name is Christy Imhoff, and that beautiful boy is my son, Reese. I'll be able to do this. This is my older son, Max, my husband, Paul. You know, first I just want to thank Christina and Anne for all of the support and the love and this incredible conference they put together. I know everyone that's come up here has been blown away by everything that they pour into this. You know, we met Anne in, 2016 when my son was diagnosed, and she was just a constant support of love, encouragement, giving us ideas, who to talk to, so on and so forth, as I know she is for a lot of other families in this situation. And it was just a true blessing to meet Christina. I believe it was probably in 2017. And both of us were trying to get our hands on mifemertide because at the time it wasn't available through the FDA here. And so it's quite a rigorous process. And Christina became really a sister to me in my journey of reaching out, giving ideas, and trying to help support each other. So fast forward, we now have our foundation, RISE, which stands for the Reese Imhoff Strength and Encouragement Foundation. You'll notice cancer is not in the name, and that's for a reason, is our son told us, look, Mom, I don't want to be known for a horrible disease. I want to be known for being brave and courageous and strong and tenacious, and that he is for sure. Reese, just to tell you a little bit about his journey, he conquered over 19 different chemotherapies over a course of 3 years, which is a tremendous burden on the body. He had a limb salvage surgery as well as a hemipelvectomy, and I believe we had 5 different thoracotomy surgeries. And through that entire process, he was nicknamed Reese is the Beast because he didn't lose a pound or change at all when he was going through this incredible process. But just a little story about him personally so you can know who our boy is and who's bringing this fund to the table today that I think says a lot about him. I was towards the end of Reese's journey in 2019, and we had just horrible scans, like many other times, but these ones were incredibly bad. And the doctors at the time that we had said, you know, I'm sorry, I know there's nothing that we will be able to offer Reese at this point. But we had found another team of doctors that were doing some experimental drugs, actually natural killer cells, NK-IL-16. And, you know, Reese was very bright. He's 15 at this point, knows exactly what he's facing, what he's going through. He made all of his decisions, and he very calmly, with no tears, just looked at me and said, Mom, you know what? If I'm not fighting, I'm not going to be able to enjoy my life. So tell the doctors I'll do it. And he also knew that if it didn't help him, it was going to help someone else. So that was how our son approached this entire 3 years. And so because of that, you know, really, we can't have an excuse not to fight when Reese did it that hard. So the 3 of us are here today in hopes that with what we bring to the table and all of the, you know, the wisdom and all of the passion that's in this room, that one day there's not going to be any children who are suffering and families who are suffering and siblings who lose their best friends. I mean, that's the world we want to live in, and I'm grateful that you guys are all joining us in that cause. You know, it was back in, I'm going to go backwards again to 2016, right after Reese's limb salvage surgery. We did some genetic testing, and the results of that said, oh, he would have been resistant to all of these drugs. And it was a devastating thing to hear that we just poured all this toxicity into our perfect boy and that it wasn't going to help, and it didn't. And, you know, the next year we were at the MIB conference, and our question to the team of doctors was the personalized medicine. You know, how can we gather more information from each of these individual children before just going straight to that MAP therapy? So when we were listening to Dr. Cluxton's presentation and his passion, really aligned with what we would love to see for all of these kids, and him studying this at that kind of macro level for that personalized medicine, we really felt a sense of hope. So with that said, we'd like to present this to Dr. Cluxton. Thank you for your patience with my tears, and we're excited to be here.